Okay, welcome to our presentation. This is Mike McKelly, Jacob Johnson, and Cody Rawlings. Our presentation for Bio 221 from BYU, Idaho, October 6th, 2017. And our presentation is on syphilis. Next. And okay, what is syphilis? So syphilis is a sexually transmitted disease. It's spread. It's a gram-negative bacterium. The active bacterium is Treponema pallidum. And syphilis is unfortunately a very popular disease. We'll find it all over the world. It can be transmitted from anyone having sex together. It can also be passed on from mothers to newborns. Since it's gram-negative bacteria, it can be treated with specific antibiotics, usually the penicillin type drugs and other drugs. But in the past, it was greatly feared before the invention of penicillin antibiotics. It was a terribly disfiguring disease. Especially bad was the last stage, the tertiary or gummatous stage. Next. Okay, so the shape and motility. So as you can see by the structure there, the shape of the bacteria, it's a corkscrew appearance called the spirochete. It burrows its way into the cells and enters the body. It was first discovered, isolated by Fritz Schaunen and Erich Hoffmann. It was identified by them as the causative agent organism in 1905. And Paul Ehrlich developed the first effective treatment for syphilis. It was called Salvarsan, but it wasn't until 1943 that penicillin's efficacy was confirmed in trials. Unfortunately, before this time, mercury and isolation were usually the treatment that they used, but these side effects, especially for mercury, was often worse than the disease itself. If left untreated, it has a prolonged course. Only a small portion of the sufferers that can usually die from the infection, usually after very long, many years of having it. And in some areas where medicine isn't available, it's usually where we see it now. These people may suffer from neurologic or cardiovascular complications. Next. Okay, the reservoir, humans are the only reservoir for this disease. It has an increase in, we do see an increase in developed countries among men who have sex with men, and children born of mothers with disease can get congenital syphilis. Fortunately, there are no animal reservoirs for this disease. Only humans usually get it. The most common mode of infection, like we said, is unprotected sex, and sometimes even when protected. So you do have to be careful. Mothers to infants also can be passed by them, and rarely it can be passed on by blood-borne infection. Children born with syphilis usually have a higher risk of complications, and especially troubling is in Sub-Saharan Africa, where we see a higher than normal rate due to the poor medical care available. Next. Okay, so the New World's syphilis goes back to antiquity, but it was actually after Columbus's return back from the American continent that we saw a big increase in Europe. It remains a global health problem today. Most new cases are in developing and poor countries, as we see. The first reported cases were in Europe, like I was saying, happened in Naples. They called it the French disease. And then about 0.5% of adults worldwide will be affected with this disease. There are about 6 million new cases a year. This was in 2012. But it's down from 1999, where there were about 12 million new cases, and 90% of these were in developing countries. It can cause spontaneous abortions, stillbirths, and congenital syphilis. Also, rates are higher among IV users and people who have HIV and men who have sex with men. Next. Okay, lastly, symptoms of syphilis can be difficult to identify sometimes because it can imitate other disease. That's why they call it the great imitator. You can diagnostically, definitively diagnose it with a blood test or field microscopy or looking at fluid from a sore of an infected person. And today, luckily, because of the availability of other medications, we can treat it much better.
The usual time between acquiring the disease of syphilis and the start of the first symptoms is around 21 days. However, that range can be from about 10 to 90 days. Syphilis is sometimes known as the Great Pretender because its symptoms can be mistaken for many other diseases. Nevertheless, syphilis most often follows a progression of stages that can last for weeks, months, or even years. There are 4 main stages of syphilis. The first 2 stages are often mild and can be hard to identify or notice. In the 3rd stage, there's no signs or symptoms. And after that, the 4th stage is when it starts affecting the internal organs. The primary stage. This is the onset of canker sores, and it is often accompanied by mini sores. The cankers usually can heal up on their own in about 3 to 6 weeks. And the canker sores are usually small, round, and painless. However, they can be hard to notice or find because of this. And the canker sores will heal regardless of if they receive treatment. However, if they are not treated, the disease will progress to the 2nd stage. In the 2nd stage, there are skin rashes and lesions, such as sores in the mouth, vagina, or anus. The secondary stage usually starts with the development of a rash on one or more areas of the body. Rashes associated with secondary syphilis can appear when the primary canker is healing or several weeks after the canker has healed. The rash usually does not cause itching. The rash may appear rough, red, or reddish brown spots, both on the palm of the hands and bottom of the feet. And with the rash, there's some other symptoms such as swollen lymph nodes, fever, sore throat, patchy hair loss, headaches, body aches, and extreme tiredness. In the 3rd stage, it's also known as the latent stage. There are no signs or symptoms in this stage. The bacteria is still alive, but it's not contagious. It can still affect your heart, brain, nerves, and bones, and other body parts if it's not treated. And this phase can last for years. Some people may not ever experience this stage or go right to the 4th stage. The 4th stage is also called the tertiary stage. Tertiary syphilis is rare and develops as a result of untreated syphilis. It can appear 10 to 30 years after infection was first acquired, and it can be fatal. Tertiary syphilis starts affecting multiple organ systems such as the brain, nerves, eyes, heart, blood vessels, liver, bones, and joints. Symptoms of tertiary syphilis vary depending on the organ system affected. So the transmission of syphilis. So those are some of the main symptoms. I'm not going on how it's transmitted. It can be transmitted from direct contact of canker sores. And those cankers, occur anywhere on the body, really. And so if you come in contact with those sores, it can be spread. And this is why it's easily transferred through sexual activities because of this. It can also be transmitted when a pregnant woman with syphilis has it and can get to her unborn child. And when a pregnant woman has syphilis, the infection can be transmitted to her baby. So they should be tested for syphilis in the first prenatal visit. An infected baby born alive may not have any signs or symptoms of the disease. However, if not treated immediately, the baby may develop serious problems within a few weeks. Untreated babies may become developmentally delayed, have seizures, or die. And so it's very important for women who are in high-risk areas of syphilis to get treated. And if they have ever had it, they get tested frequently and make sure they're not going to be at risk for their unborn child.
Treatment. Syphilis can be cured with the right antibiotics. However, treatment will not undo any damage that the infection has already caused. So, under the stages of syphilis chart, we see primary, secondary, early latent. Then on the right side, we see recommended treatment. So for primary, secondary, and early latent, the recommended treatment is 1 dose of benzathine penicillin G, 2.4 million units, administered intramuscularly. Latent syphilis, which means 1-year duration or of an unknown duration. The recommended treatment is benzathine penicillin G, 7.2 million units total, administered as 3 doses of 2.4 million units, administered intramuscularly, each at 1-week intervals. And then we have tertiary syphilis, and the treatment is 7.2 million units total, administered in 3 doses, as the same with latent, in 1-week intervals. Syphilis in pregnancy. Pregnant women should be treated with penicillin appropriate for their stage of infection. Pregnant women with a penicillin allergy will need to undergo penicillin desensitization protocol. Doxycycline and tetracycline can be used if the mother is allergic and if anyone is allergic. Congenital syphilis, penicillin G or procaine penicillin G. The recommended dose is 100,000 to 150,000 units. Prevention and control. The only way to avoid syphilis is to forgo having sex. The next best option is to have mutual monogamous sex with one partner who is faithful and uninfected. Use a latex condom. Condoms can reduce the risk of contracting syphilis, but only if the condom covers the sores. So for primary prevention, we need promotion of safer sex and risk reduction. We need promotion of abstinence and proper condom use outside of the LDS bubble and inside the LDS bubble. We need to have better education on proper condom use. Of course, we promote abstinence, but we know that's not always the case with curious teens. Information campaigns regarding association of HIV and other STDs, if we don't get the information out there, people aren't going to know. In a clinical aspect, we need to test all male and male sexual partners at least once a year, more if they are at higher risk. We also need to ensure proper education early about being exposed to STDs like syphilis. In my epidemiology class, we learned that in the gay world, many are exposed to STDs and HIV, but not necessarily contract it. We need proper education on this matter to help reduce STD rates. We need to test all expecting mothers and ensure they don't have syphilis. If they do, we need to treat it properly. And we need to ensure that if the mother hasn't been treated, that the child is treated. Secondary prevention. So if you already have the infection, it's vital that we increase accessible and effective health care with proper medications, education and counseling to help people who are diagnosed with the emotional aspects of contracting an STD. And we need to also help inform all of their partners. We need to have early detection and completion of treatment. A lot of parents don't think their teen is sexually active. Don't be a naive parent. Get your teen tested. Abstinence while infected is the key at stopping the spread of syphilis. Even if you use a condom, you will most likely not be able to cover up all of your sores. So abstinence is the key. And we need to help ensure that if someone has been infected, that we help inform them. Thank you for watching our presentation on syphilis. We hope you have all your questions answered about syphilis and have a great day.